Hi guys, Dr. Mo here and welcome back to the channel. Today we're going to talk about seasonal affective disorder, also known as seasonal depression. Many people have experienced seasonal depression. It is extremely common, especially this time of the year. But the one thing that we want to keep in mind that if you are that person that's experiencing seasonal depression, you are not alone. Approximately 3 million people in the United States alone suffer from seasonal affective disorder. Therefore, you are definitely not a lone soldier, and there are so many things that we can do to help you during this time. A little bit about seasonal affective disorder. It is a mood disorder. Many people don't realize that it's characterized by several different things that you may think are very common in other conditions, but it's definitely something that happens at a certain time during the year. A lot of people think that it just happens during the winter. No, it probably is more prevalent during that time or during the time when there's less daylight and there's longer nights, but it also could happen for some people during a certain season throughout the year. It could be indicative of just their mood, or it could have been triggered by something that transpired in the course of their past. Many people associate certain dates and times of the year with where their mood will really change, and during that time is when you would definitely see the seasonal affective disorder. I can tell you that most of the people that I've seen happen to fall within that fall window. A lot of people do not like when our daylight savings time goes away and that we start experiencing these extremely long nights. Some of the characteristics or some of the traits will be loss of energy. If you're experiencing a loss of energy and you don't understand quite why you are experiencing that loss of energy, that could be it. Also, when you think about the lack of desire, when you have a loss in interest, things that you once were interested in, or no desire to do the things that you love the most, you probably are in the beginning phase or you're experiencing a seasonal depression. When you are also noticing a difference in your appetite, if you are a person that actually you have a hearty appetite and you could eat a full meal, but now all of a sudden you're not so hungry anymore. You really don't want to eat a lot, or you've noticed that there's a fluctuation in your weight. Either you've gained weight because you are emotionally eating, or you've lost weight because you have no appetite. Those type things are things that you would notice. If you have a difficulty concentrating, and you just can't concentrate on anything, those are things that you want to take note of. Feeling sluggish and just totally disengaged. You are sluggish, you're tired most often, and you just don't want to be bothered. It's definitely a sign. You also want to make sure that you're not agitated. If you are finding that you're more agitated than you normally are, and you just feel depressed most of the day, or a great deal of the day, nearly every day, there is a reason to be concerned. And we want to make sure that you understand that if you're experiencing those symptoms, and not every symptom, but you're experiencing several symptoms, you definitely want to get help. And before you get help, I want you to just understand there's nothing to be ashamed of. And we want to make sure that you understand what will transpire during the help. There are different ways to treat seasonal depression. One is through therapy. Cognitive behavioral therapy is very widely used. You want to make sure that you are in an environment where you can gain therapy and you can get help from a person that's licensed and trained to care for your condition. The one thing about therapy is that most therapists will allow you to express how you feel, and they will listen to you and provide insight and actually put you on a treatment plan that will assist you over the course of the next couple of weeks or months, however long you need. You want to make sure that you understand that this may not go away right away, but with good therapy over a period of time, you will start to returning to your baseline. The other type of treatment I want you to consider will be medication. There are several types of medications that you can take. We will discuss a few of them, but antidepressants are very widely used. Some people have some apprehension about using any type of medication, but I want you to know that the medications that you will possibly be prescribed, or even at least they will be discussed with you, are medications that are safe and have been approved and are being used by many people. Not to say that you won't have a side effect or two, but believe me and trust me when I tell you that there are many antidepressants, and I'm sure that there's one out there that will meet your needs and you will become happy with. Your healthcare provider will definitely go over those type things with you to ensure that you have a full idea of what it is that's available to you. The other thing I want you to consider too is self-care. Self-care is very, very important, not just when you're experiencing seasonal affective disorder or seasonal depression, but it's extremely important that you feel that you are important enough to care for yourself in a manner that will improve your health and your quality of life over the period of time. The things that you can do that are low cost or no cost would be just exercising, being able to go outside. If you're an outside person and it makes you feel good, go outside and take a walk when there is daylight. You could also time it so that you can take a walk. If walking makes you feel good, then take the walk later in the day, because it will have you positive so that when the sun set and darkness come into play, you'll be fine. Even if you find that you're working throughout the day and it's dark when you wake up and it's dark when you go home, actually you can go to a local gym. Many of the gyms, I know that in certain areas you have gyms that are open 24 hours. You may want to get a membership there. I know that it's not a cost. It is a cost associated with it, but I believe in self-care. When you're providing self-care, you should want to invest in yourself. The other things that you can do are things such as doing creative things that you like to do, getting out of your comfort zone and doing things such as going to a museum or doing even journaling. You can actually journal. That doesn't cost you very much. You can journal and write down about how you feel, and you can express those things in your sessions with your therapist. You can also just invite friends over. Be around people that you genuinely love, who love you, and I can assure you that they will help you get through this difficult time. You can also do things such as go to a movie, hang out at the bowling alley, just something to get your mind off of what's going on with the season. Also, you can do those things like going to get your nails done and getting your hair done. Sometimes when your appearance change and you look good, you feel good, and you act accordingly. So those are type things that you could definitely do to enhance yourself and improve your mental state during this time while you're dealing with seasonal affective disorder. There are so many options out there. There are so many options, so many options out there that I'm sure that if you go out and you seek help, they'll find the ideal treatment plan for you that will improve your health over the short term. And before you know it, you'll be getting through the seasonal affective disorder and you'll be back to your baseline. I'm Dr. Mo. I hope this has been helpful. Until next time, thank you.